Hello YouTube, I am day 15 post-op. Went and met with my surgeon yesterday for the first time since surgery. He checked out my belly, said everything was going well. I had a long list of questions for him because I've been surfing different forums and things, and there were some things that I didn't know ridiculously, like where the heck my port was. And I found that out yesterday. It's in the only tender spot that's still on my belly that I haven't been able to touch. So I haven't been feeling around or anything like that to see where it was, but found out where that was, asked him about percentages of ports flipping and things like that, which he told me is typically about 1 to 2%. He said in the procedure that he did with me, my port is actually anchored to my abdomen wall with hooks, which sounds kind of gross, but he said there was a very low chance that my port would flip. So that was good. He said there was also nothing that I could do to prevent it from flipping. If it flipped, it flipped. And I guess that's not anything to really freak out about, but I had been reading, some places where folks' ports had flipped, and that causes for them to have to go in and do a revision. So I had been thinking about that. I also registered at the lapband website because I do have the actual lapband, which is a brand name. There's all different kinds of bands out there. And found out that each one of our bands has a serial number. And if you get that serial number and plug it into that website after you create a profile, they'll send you something. It's like a little card you can take to restaurants that basically lets them know that you had the surgery. Not that we can't do it ourselves, but it allows certain restaurants, I guess, are actually on board with it, and other restaurants may not be. But anyway, I just thought it was a cool thing to have. You can order off the lunch menu at any time, probably get some portions modified if you needed to, and maybe have some things cooked differently. So I'm going to send off for that soon. The other thing I found out was I was kind of scared to have sex. Don't want to gross anybody out, but I was given permission to do that. Also, I got my 5-pound weight restriction lifted, so I'm now able to lift up to 25 pounds. I spoke with him about what I was doing as far as exercise. So basically what I've been doing is I have a treadmill out of my garage. I've been getting on that pretty much every day for about an hour, trying to, vary the inclines and the speeds, and trying to, I try to work my arms while I'm on there too. Haven't been using any weights, but my arms are like weights, and I'll show you those in a minute because my husband encouraged me. He's like, all you're doing is showing your face, but it's really kind of hard to show everything else when I'm here doing this video by myself. But anyways, I'll try to attempt to do that in a minute. So anyways, I get on the treadmill for about an hour a day, and he said that that was fine, just to continue to exercise as I felt comfortable. He told me not to get too much into the weightlifting, but I do have a little weight set, and he said I could use 3, 5, and 10-pound weights, so that will be fine, just not to overdo it. I'm still not feeling any pain. I think, as I mentioned earlier, I do have some tenderness on my belly where I found out where my port is, and it's right up under the biggest incision that I have. But other than that, the last time I took Tylenol was probably about 3 days ago, and I have not been taking it consistently. I think it was just the day where I was doing too much, went grocery shopping, exercise, vacuum, and took the dog to the vet, just like doing whatever I wanted to do. And I was feeling a little achy after that. No gas still. I have no restriction. I am able to eat lots of things, but I have been sticking to my protein diet. Met with the nutritionist again yesterday, and they moved me to a step 3 diet, which basically I can now begin to incorporate fruits and vegetables back into my diets, and some carbs, which was surprising to me. He mentioned things like saltine crackers and some of the more crunchier cereals, but I am going to stay away from those things because that is my downfall. I have been getting, I believe, enough carbs in with the beans that I've been eating for my protein. So I'm going to just stay away from that. I'm still right now doing 1 protein shake a day. I normally make that my breakfast, and I get about 42, 44 grams with that, and then still just eating protein rich foods. Also, I'm able to incorporate soft moist meats into my diet now, which I've already been doing, which I told him. I've been basically broiling fish every night, which is really soft and nice. And since my palate is pretty clean of all the sweets and stuff that I used to eat all the time, the fish actually has a nice sweet taste to it. So I've been enjoying that. I did find that he brought out the little fake foods, and I have been eating too much, which was surprising because I have still been eating right around 1,000 calories or less a day, but my portion sizes are still kind of too large. So where I was eating a half a cup of cottage cheese, I'm only supposed to be eating a fourth of a cup. And the fish that I was eating, which is pretty much like the size of my hand, I was eating the whole piece, and I'm only supposed to be eating half of that. I don't even know. It may have even been a quarter of that. It's supposed to be like 1 ounce, and I'm probably eating 4, maybe 5. Yikes. But I have been listening to my body more. I have not entered Banster Hill yet. Thank the Lord. I'm only day 15, so I have really still not been hungry, but still trying to eat the 6 small meals as recommended to keep my metabolism going. Scale had not moved for me in several days. It finally did move a little bit for me yesterday, and I'll post those numbers underneath here in a bit. Let's see. One of the things I think I failed to mention in my last video is that I think at some point I told you guys that I was a diabetic. I am a diabetic, and I was taking 2 different medications. My blood sugars have been controlled since surgery. They were running about 72 out of the surgery when I got home. They've been running anywhere from the low to mid 80s up to the highest I've seen since I've been home is about 118. So I called my doctor, and I'm like, man, I really was afraid to start back taking my 2 medications, like I said, having numbers like that, which are really good. And I called her, and she said, stop everything. She said, discontinue the 1 medication that we had added recently altogether. And then she said I could take my other medication and split it in half and a half dose if my sugars were to go above 138 fasting in the morning, which they have not. So I'm super, super excited about that. I have been feeling great in regards to my diabetes. I have not had any vision changes. I have been feeling less fatigued. I have been making sure that in the morning that I get up, get out of the bed, and get moving. So I'm really feeling great. I guess another highlight for yesterday is I was able to also get a little bit more time off work. And I don't want to seem like I'm being greedy, but I don't know when I'll ever be able to be off work like this again. So I'm taking advantage of it. So I got another 2 weeks off work. Yay! Also found out that my surgeon does not like to do the first fill till 6 weeks post-op. And I had been reading in some forums where some folks had gone back 3 weeks, 4 weeks, and had gotten their first fill. So my first fill date will not be until March 30th. So I'm looking forward to that. And then I won't see my surgeon again to the 2-month, 6-month, and I guess 1 year mark if things continue to go the way they have, which has been pretty good. I'm also excited to let you guys know that yesterday I accompanied my husband to his pre-operative anesthesia blood workup appointment. So I'm really excited for him. His surgery date is 3/13. He's getting really excited. He did not have to do a pre-op diet, but has been pretty much eating what I've been eating with a little bit of added calories. He's been still able to eat the roughage, the fruits and vegetables, but he has incredibly lost 20 pounds. I'm so proud of him. He's looking really good. So he will have his surgery on 3/13, and we can start this thing together. I am so happy I got this lap band. This is one of the best things that I could have ever done for myself. Even though I haven't lost a significant amount of weight yet, I am feeling great and I'm feeling excited. And I just hope that I can continue to feel this well emotionally, physically, and mentally, even when the scale stops moving, which I know will at some point happen, probably soon, because I don't have anything in my band. Oh, I did find out that I have a 10cc band, I believe, and there's about 1cc in there that was placed at surgery. So anyways, I'm going to try to show you guys what I look like. So this is my arms, and this is the bat wing that I'm really feeling uncomfortable about. So I try to work that when I'm on the treadmill, and I'll start doing some weights and stuff like that when I can. And I actually have on 2 bras for some liftage. So this shirt used to be really snug on me. It still kind of probably shouldn't be wearing it, but I am. So this is my side view. This is kind of how I look right now. And this big baby right here is my big incision, and my port is somewhere up in here. I can't really touch it too hard. Still a little bit of swelling if you can't see. That's just a birthmark and stretch marks. But anyway, here I am. I do have some full body shots someplace that I'll probably make a little slideshow of and post at some point. But anyways, I just wanted to let you guys know how I was doing. 14 days, well, now 15 days post-op, doing great. And probably will not check in as often unless something crazy good or crazy bad happens. Maybe I'll check in, once a week just to let you guys know. But pretty much from here, it's smooth sailing. Definitely will check back in after my first fill. But like I said, if anything significant happens or if I have any more news to share, I'll check in. So, all right, YouTube. Good luck, Bandsters.